Knee external range of motion, passive range hold is going to work on closing the gap between your passive range of motion, your flexibility, and your active range of motion or your strength. What we are going to do is pull ourselves into our external range of motion, end range position, contract the muscles of external rotation, the muscles that do that movement in our knee, which is going to be the outside back hamstring here. Slowly release our hand support. So slowly release and try to maintain that position. A lot of people who are working on this exercise are going to need it because as they release their hand support, they're going to fall out of the position a lot because they have lots of flexibility, not a lot of strength or control of it, which is why we do the exercise. So your goal is to have yourself fall out of the position as little as possible. And as you're holding, you might feel like you fatigue and you come out of the position. That's okay. Your goal is just to slowly fail out of the position with some breaks. So you're trying to fail slower than if you were to not try and it would just kind of fall entirely really quickly out of position. So once again, find your end range position here. I use my hand to pull my calf to really get that rotation, to feel that stretch through here. Then from there, contract those muscles, the muscles that are trying to do this motion. Slowly release the hand support. Try to hold that position without compensating all over the place for the prescribed amount of time. Typically, it's going to be anywhere from 5 to 30 plus seconds, depending on if you have added resistance. And then that is one rep of this exercise. So obviously perform the amount of reps and sets for your program. But as you do this consistently, you should feel that you're gaining more access to your strength, and you should feel that you fail out of it less and less, which indicates that you are gaining access to more and more of your tissues in your passive range of motion and turning it more into active usable range of motion, which is going to make a happy, healthy knee and also help you own and access more positions for your knee, which can also do things like improve your performance.